Here's Dixie. Dixie's a cocker lab cross, and she's limping. The right leg, when a dog limps, they don't step out on the right leg as far, and they step farther on the left. So here she comes. She's walking. She's not walking far on the right leg. See that? And on the left leg, she is walking. We'll keep doing it on and on until you get it. Here we go. Right leg. Yep, there. And one more time, Robin. Boy, you're doing good. We're getting our workout today, aren't we?
Yeah.
There we go. Let's go up. There she's limping. You might have noticed it as we turned her again and again in the hall, that she wasn't putting full weight on her right leg and she was stepping ahead with her left leg. So a lot of dogs come in with arthritis in the hips, arthritis in the back, and some of them will strain or tear their knee. It's called an anterior cruciate ligament. It holds the knee together, and I'll show you that on our model. So what is the ACL ligament? Where is it and how do they tear it? Well, let's just show you on this little dog, our pet named Boney. This is the skull and the spine and the scapula and the humerus and the front legs. Back here in the stifle or knee is where the ACL is. It attaches, it stabilizes this joint from this bone to this bone. So let's show you on a model. If we take this joint and we cut the bone there and there, we get this. And this is the patella, the kneecap that fits in the groove. And it's attached to muscles up here. So let's take the kneecap out and then show you that the ACL ligament goes from the back of the femur to the front of the tibia. So it's designated or shown by this plastic tendon that goes from there to there. That keeps the joint from sliding too much, like this. So what happens when a dog tears it, I can put my hands like this, and with that ligament gone, it really moves. And if it moves, then it rubs and it can wear out the cartilage and cause a lot of arthritis. And that's if there's a lot of movement and the dog's really lame, it's better to fix it. But if there isn't much movement and the dog isn't too lame, then sometimes we let it go. And it's funny, if you don't have the money to fix it, the several $1,000s to fix it, most dogs will get over it to some degree. How we test is we take the knee, the stifle or the knee, and we put our fingers on the end of the bone, the femur, and the tibia, and then our thumbs behind each bone, and we move it. Now, it shouldn't move forward like that. It's really moving forward. So I can push the tibia forward ahead of the femur. I'm pushing it. So it's wiggling a lot. You might not be able to see that very well, but it's easily felt. So another way to tell is there's a lot of pain in the knee. So if you look down here again, if I extend the knee, Dixie's getting up. She's such a stoic dog, so I push the knee, extend it, and I can feel shaking. And she's lifting her head up, which means she's sore. That could either be a strain, a pulled muscle, arthritis, or a torn cruciate ligament. But whenever I do this drawer sign, then that means it's a torn cruciate ligament. So Dixie's just laying on our x-ray table. Isn't that cute? Look at her. Dixie, how do you feel? You like it up here? We're going to take a look at your x-rays. Your back is kind of hurting too. I thought I felt it. So on this leg that she now is injured, we look for any fractures or any other problems. We make sure the hips are okay and the hips aren't dysplastic. And if everything looks good, we don't see any fractures, we don't see any other problems, then we can consider either conservative therapy, which is maybe a brace, working out, strengthening up the muscles in the leg and in the joint, or repairing it with a TPL surgery or another surgery. So if your dog had a sore back, how would you know? Well, I'll show you. I just thought I'd delay. I'll show you. Sometimes dogs with sore backs, when you pick them up, like that, they yelp. If you take your hands along the spine and you can feel the bony spine in your dog's back like this, right here, if you press in and see how the fur's moving back, she's really twitching when her muscles are really twitching when I do that. So her back's a little sore in this area, and some dogs will really just almost just sit down. So you can feel with your fingers that there's a lot of shaking in the muscles. Now, normal dogs will do that too, but dogs with a sore back will really be painful. So let's look at the x-rays and see what that looks like. So, on the x-rays, you can see there's the vertebrae, which are these right here. And this is Dixie's spine. Here's the vertebrae. Here's the disc spaces in between the vertebrae. And the spines of the vertebrae going up where the muscles are attached. We were pushing on the muscles in these areas, and we're pushing down, and it pushes on the nerves that are in the disc area. They come out this little hole. That's where all the nerves come out to the rest of the body. And as you push, it puts pressure on these and causes pain. That's why they quiver. So just to orient you to the rest of the body, this is the abdomen where the intestines are. Here's the intestines filled with gas. Here's the colon with a big bunch of poop in it, and it's ready to go out. Here's the hips and the legs, the femurs. And if you look at these vertebrae, all the vertebrae are fairly smooth under here. If you look at this one, it's got little spikes coming out. That's because it's bridging spondylosis. What happens is when the disc collapses, when that spacer shrinks, then the body tries to strengthen that so it doesn't move with a bridge. And that's a sign that this area is weakened. So Dixie not only has the Dixie not only has the tear in her knee causing her to limp, but she has also back pain. If we do surgery on that torn ACL, then when she's healing, it's going to put a lot of torque on her back and on her spine where she has arthritis, and that might make her hurt more. So we'll have to talk it over with the owner. But so that's the kind of things veterinarians have to weigh. We have to weigh the surgery, the benefit, and the harm to other things. So she has the torn ACL ligament in her leg, and also she has the arthritis in her back. But sometimes some dogs do okay with rehab with the ACL tear. If it's not torn too badly, if it's a partial tear, and the joint doesn't move too much, then sometimes rehab can help, especially on smaller dogs like Dixie. A big dog is usually better to do surgery because then they have less arthritis in the rest of their lives. I've had several friends that say, Greg, I can't afford $3,000 or $4,000 to fix it. So they just walk the dog slowly over several months' time. And the dog might always have a little limp, but they do pretty well. So that's your decision. If you want the best fix, go check with your veterinarian and see what they recommend as far as surgery or conservative treatment.
Well, dogs are having problems with their ACL ligaments real commonly now. I think it's because a lot are overweight, out of shape, and they go out and play real hard and they rip it. A lot of breeders think they should be castrated later in life or neutered because they think the hormones help strengthen the ligaments of the knee. And in larger dogs, I've been thinking about that, and maybe they have a point. Maybe it's not such a bad idea to wait till 6 or 7 months or 8 months to neuter an animal. Maybe it does make their ligaments stronger so they don't rip out their ACLs. Another thing is keeping the weight down in your dog and taking it out for daily exercise really would help prevent this. If your dog eats kibble and it's real overweight, you can use the tips in dog dish diet to help it lose weight or you can even make a weight loss formula using chicken and green beans or chicken and other vegetables. Kibble just has high calories, and a lot of dogs can't really tolerate the kibble, the carbohydrate in the kibble. Another thing is that if your dog's overweight, don't leave kibble out all the time. You need to feed it just twice a day, once or twice a day, and you can do other things to help them lose weight. That's real important. As far as the ACL tears, if you take it to your veterinarian, myself and a lot of vets are going to want to fix it because we know that that's probably the best for most dogs. But some dogs, if they wear brace and you slowly bring them back on it by walking and lots of activity gradually, their ACLs and their knees heal up pretty good. They might have more of a limp than they would if they had the surgery, but because it's a costly surgery, many people just have to do that. So that's a decision that you'll have to make with your veterinarian and with your pocketbook. So if your dog does hurt itself, you can go to my 11 practical home remedies for minor illnesses, and it tells you doses of aspirin, pain relievers. And then check out my website, Dog Dish Diet. I used to think it was just good to keep dogs from having problems like with allergies or bladder problems or seizures, but I just think it's a good, healthy way for dogs to eat. Well, have a great day. Thanks for watching.